Hiya, welcome to Myths and Truths about Cervical Cancer Prevention. My name is Karen and I work for the Eve Appeal, the UK's leading gynae cancer charity, and I'm joined by the brilliant Adeola and Karen, gynaecologist and trustee and friend of the Eve Appeal. So we've had people emailing in some questions, some myths that they've heard, some rumours, so let's just start answering some questions if that's okay with you.
Certainly.
Thank you. Well, that's what we're here for. What are the symptoms of cervical cancer, and can they also be signs of less serious conditions? So we don't want to freak anybody out and worry them, but also want to give the best information.
So the symptoms usually are bleeding after sex, bleeding between periods, bleeding after the menopause, and an offensive discharge. Now, most people, the vast majority of people who have these symptoms will not have cervical cancer. They may have something like an infection or a polyp. But it's really important you don't ignore the symptoms. You go and tell your GP about it, and you have appropriate investigations to exclude cervical cancer.
So to sum up, main symptoms of cervical cancer are bleeding in between periods, bleeding after sex, bleeding after the menopause, i.e. not having had a period for a year, and an unusual or foul-smelling offensive discharge. Probably, as Adeola said, not going to be cervical cancer. It's probably something less serious, but still please get checked out just in case. My mum had cervical cancer. Does this mean I will get it?
There is no obvious genetic link to cervical cancer. It's more environmental and behaviour. So no, you're not at greater risk, but it is still important that you follow the rules. If you're of the age, get the HPV vaccine, go for regular screening, report any abnormal symptoms.
So it's not a hereditary disease?
No.
Smoking causes cervical cancer, true or false?
True, it does, and it causes it because it can interfere with the immune system of your cervix. It can reduce the ability of your cervix to clear HPV infection, and persistent HPV infection is what puts women at risk of cervical cancer. And it's never too late to stop, and we know that even people who have had mildly abnormal changes on their cervix, if they stop smoking, the changes can regress. So if you're listening to this now and you're a smoker, it's never too late. Stop smoking. It does significantly reduce the risk of cervical cancer.
My last smear was clear. It was 2 years ago, but now I'm bleeding after sex. Should I worry?
Any abnormal symptoms should be reported, even if you had a normal smear last week. The reason is a smear is a screening test. If it says that there's nothing wrong, if it says it's normal, then it means there's unlikely to be a problem with your cervix. But it doesn't predict for the future, and also sometimes you can get false negative smears. That's a smear that says there's nothing wrong, while in fact there is a problem with the cervix.
Why are smear tests every 3 to 5 years? Because that, to be fair, I understand this point, that doesn't sound like it's very often when it's for something so serious like checking for something that could turn into a cancer.
So if you remember, what smears are not looking for cancer. They're looking for changes which could potentially put you at risk of cancer. If you have a negative smear, people have done clever statistics to show that it's fine to wait 3 years because in 3 years you're unlikely to develop cancer. You may develop changes, but they can still be picked up and still be treated. The point is to try and get everybody to have smears regularly rather than a small segment of society having smears very frequently. And those statistics indicate that this is the safest time interval.
I had cervical cancer 10 years ago. Is it true that I don't need smear tests?
That is true. A smear test is a test for preventing cancer. If you've already been treated for cervical cancer, then you need to be looked after by your specialist and followed up according to their protocol. Smears, especially after radiotherapy, can be misinterpreted and can lead to unnecessary worry, as well as being actually very difficult to get.
Yeah. Quite a few people don't believe in, I say few, tens of thousands, probably millions, believe in vaccinating their children. It's a massive issue. It's a huge topic. We obviously can't go through everything. But what would you say to people who are choosing to go down the homeopathic route rather than traditional medicine, traditional vaccinations?
So I work with homeopaths, and sensible homeopaths will tell you that they can't replace medicine. They can support you They can give you things to make you feel better, but they will never say that they can cure you or that they offer an alternative to vaccination, which we know is safe and effective.
So typically, unless somebody's had an abnormal result, the screening programme will finish for them at 64. So what about people who are in their 70s, 80s, who are embarking on new relationships, having new sexual contact, exposing themselves essentially to HPV virus, perhaps for the first time in decades? What can that 70, 80-year-old person do to kind of look after their cervical health if they're not on the screening sort of radar anymore?
So it's interesting because although the letters stop after the age of 64, you can actually still request a cervical smear if you wish it. So what I would suggest is that the woman that you've just described should contact her GP and ask to have a smear test done and ask to be put back on regular screening, and people are entitled to be screened.